All right, everyone, we are going to go ahead and get started. I want to welcome you to our HPA weekly webinar series. My name is Doug Foshi, a business development manager here at HPA, and I'll be hosting. Each week, we will be featuring a successful HPA partner, and with us this week is Rick Kesecker from Collateral Benefits. HPA is a technology and consulting company that works with brokers in order to engage with healthcare reform. We partner with agents and brokers nationally to bring them technology solutions, private exchange sites, marketing tools, training, and leverage to help them be more successful. You will also be hearing from Kyle Easterling, another business development manager here at HPA. Topics of discussion today will be a short questionnaire with Rick Kesecker and how he leverages HPA's Insight Catalyst report to increase non-health policy sales. And then Kyle will be giving us a health reform update, and I will close this out with a discussion of HPA's services. Each week, we will be featuring a partner who has been successfully utilizing the HPA business model. And today on the call, we have Rick Kesecker, Senior Vice President with Collateral Benefits Group. Recently, Rick ran a successful online marketing campaign that generated quite a few leads. And from there, he ran some very interesting ICRs. Now, for those of you who are unfamiliar with ICRs, those are Insight Catalyst reports, which is a detailed benefit analysis for employers that they can run and tell them how to engage with healthcare reform. And I really think it's one of the strongest pay or play calculators on the market. And I'll actually go into more detail on the mechanics of the ICR later on in the webinar. Anyway, on with the interview. Mr. Kesecker, I want to thank you for taking your time to speak with our current and potential partners today.
Well, thank you, Doug. I appreciate the opportunity to be here.
Absolutely. Now, when it comes to marketing, social media is an avenue that I'm constantly exploring when I'm strategizing with HPA partners. So I want to ask a couple questions about the success you had with your online marketing campaigns. So just so we can put this to rest, LinkedIn or Facebook?
That's a great question. We've conducted ad campaigns utilizing both social media sites with our corporate Facebook and LinkedIn page. LinkedIn seemed to provide a better qualified lead for us than the Facebook campaign.
Is that because it's a professional, social media community?
Absolutely. The cost per lead was a little more, but it was more qualified lead than the Facebook campaign.
Perfect.
However, the campaign that was extremely effective for us was utilizing my personal LinkedIn account.
Okay, so reaching out to the connections you made on a more personal basis than buying ad space.
Correct.
Okay. So what was the foundation of that campaign? Like, how did you get started with that?
Well, just to give you a little background, I'd like to take full credit for it, but I can't. We did utilize a resource, Jeremiah Desmarius, who is one of HPA's contacts that was given to me, who helped develop this social media campaign. But the campaign really focused on expanding my network and really targeting and joining groups within the demographic area that we're trying to penetrate, which is the state of Alabama, where we're doing the majority of our business. Then once I was able to grow the networks of groups, I was then able to target key decision makers and individuals within those groups and really approach them, and the hook or the offering really was the ICR.
Okay, fantastic. So that was, kind of go into detail. How did you engage with these new connections on LinkedIn?
Well, we utilized two different messages. But first of all, I guess, to go back up is the groups that we approached. I wanted to identify the groups, a member of a lot of the national associations and groups, but really wanted to kind of target in a little more specific in the demographic area of Birmingham and the surrounding area. So really reached out and did some exploration and found groups such as Birmingham Entrepreneurs, Business Leaders Roundtable, Alabama Professional Networking Group, and there were numerous local HR groups as well as some CEO and CFO networks that I joined that kind of gave me the opportunity to then go out and reach out to individuals within those groups that were key decision makers.
Okay. And okay, so what you just said, that was the goal, is to reach out and get a connection with a decision maker.
Absolutely. You know, you can make cold call prospect calls all day long, but getting to the key decision maker is half the battle. So through networking with these groups, we was pretty able to determine whether or not that individual was the key decision maker or not. And in the case, you know, we utilized two different messages that we sent out to the contacts, depending on whether or not they were the CEO, president, owner of the company, or someone, you know, at a lower position.
Right. So when you actually got, or really, what did you find was the easiest, or what hooked in that decision maker? What methods did you use?
Well, we basically narrowed it down and used two types of messages. If I wasn't sure it was the decision maker, or that person wasn't identifiable as the decision maker, and I couldn't verify that, you know, whether a website or company information, I sent a generic kind of email, and the title of it was "Quick Question," and the basis of that email were, you know, I'm doing some research on your company to determine if there's a need for navigating the Affordable Care Act with all the rate increases and penalties that companies are going to face. Could you please point me in the direction of the best person to contact to have a short discussion?
Okay.
And if it was the decision maker, it went a lot more in depth, but just that I'm reaching out, I've created an executive report, which basically is the ICR sample report for HR professionals to protect themselves from some of the complications and rate hikes as a result of the Affordable Care Act. This report gives you several points to consider for your employee benefits, and I'm sure you'll find it useful whether you're considering dropping coverage, saving on your premium, or using one of the more creative options like private public exchanges. Then if they were interested, just send a reply with yes, and if they'd like more specific information to drill down based on their company, I'd ask them to include their employee size. I was really taken back with the response rate from that campaign, as I really didn't expect the response or conversion rate to be very high, but I was pleasantly surprised and impressed with the response and the acceptance. I got about a 10% response rate from the emails that I sent out, but the great thing about it was, because these were local companies in the area where we do business, my intent was to set up a face-to-face appointment.
Sure.
And the conversion ratio is about 30% on the 10% response rate.
And if you can get the face-to-face appointment, you've got them.
Oh, absolutely. Yeah. Absolutely. You can sit down, you drill down, and what that led to was really position ourselves to be able to do an insight catalyst report for that particular business.
Right. Get their specific census data and run a report tool towards them, like what we have on the screen here. So how much time would you recommend spending on a online marketing campaign?
Well, it's up to each individual, and depending on how much time you devote to prospecting on a weekly basis. But what I found was I do at least 5 to 10 hours a week in the initial campaign, and that was really sifting through, seeing who I was going to target, and then which message I was going to send.
Sure.
Now that I've gone through my 900 or so contacts on LinkedIn, it's a matter of adding new people, new contacts, reaching out, and following up on the ones that are still in the pipeline.
Right. Fantastic. All right. So for our current members on the call, we do have training videos in the members area with templates similar to what Rick used and saw success with. So from these leads, I actually personally saw some very interesting ICRs come across my desk from Rick. And so we're going to talk about that for a minute. So the whole point of the ICR, or Insight Catalyst Report, is to show the employer their group costs versus having all their employees on the individual market. So What was the employer most excited about when you showed them the results of this report?
Well, I think, first of all, the way the Insight Catalyst report is structured, it's very easy to read. It has an executive summary. I mean, we have the pay-for-play calculator, and we've utilized that. But what we found is employers, it can be very cumbersome. They don't have access to all the information. And basically, to run the ICR, all we need is a basic census that they have at their fingertips. Mm-hmm. And we've done groups from 15 employees to over 500.
Right. I remember that one with 500 people.
And, you know, really, it's not so much about the size of the group as it is the employee demographics. I really tried to target groups where maybe a large portion of the employees would qualify for a subsidy or within 400% of the federal poverty level. That seemed to really garner the most response and opportunity.
Okay, so employers are interested in this.
Well, they're interested in seeing this information because it's never been presented to them in this format, and they really don't have access to it. So it really helped establish me as an expert within the field and provide them something of value that they didn't know was available.
And I imagine that was your goal when you were approaching those employers.
Oh, without question.
Yeah.
You know, it's a very competitive marketplace out there. Everybody has something to offer, but I really wanted to establish myself as the knowledgeable advisor and resource regarding ACA and employee benefits and present to them options that they haven't been exposed to or were aware that are available. And really the ICR really helped set me apart from the competition because it allowed me to establish value as a benefit broker.
That's fantastic. So not only, I imagine, were you positioning yourself for these individual policies, but what other were you going after other lines of insurance as well?
Really, that was our whole intent, to be able to take over the voluntary benefits as well. And this just opened up the door to, you know, create dialogue and let us offer the complete package and solutions to the client. So it has really provided a lot of opportunities for us to get in front of clients and decision makers with the voluntary package that we probably wouldn't have got to using other sources.
Rick, that is excellent. And that is our goal here at HPA. We want to be able to provide a service to brokers to allow an HPA broker to be that much more competitive out there in the market. Mr. Kesecker, thank you so much for your time today. We really appreciate it.
Thank you for having me, Doug.
If you haven't done so already, connect with Rick on LinkedIn, and I'm sure he will be happy to answer any follow-up questions about his campaign. Now, it's great to see our partners getting such wonderful exposure. We really appreciate you sharing with us today. Now, we have a lot of newer brokers who will be following in your footsteps. We really need brokers to understand the opportunities and literal gold mine that the Affordable Care Act presents. If you are a current partner, you can find marketing training in your members area. If you aren't a current partner, you can sign up today and we can help you succeed out there in the marketplace. Now, up next is Kyle Easterling with an industry analysis on some of the latest ACA trends and news.
Thanks, Doug, and Mr. Kesecker. I appreciate you showing up today. Your advice is invaluable to our brokers out there. And hello, everyone. I'm going to touch on a few things we think are food for thought going on in the buzz of the insurance industry. We discussed this New York Times article in our webinar last week, but I felt like the major shift we are going to experience in health insurance needs to be mentioned again. So, again, in this New York Times article by Neil Irwin and Standard & Poor's Capital IQ has estimated that about 90% of American workers who currently have employer-based benefits will shift to the government exchanges. Irwin compares this massive shift to that of retirement benefits when the 401k became mainstream. The major downside for you guys is that without a private exchange solution, employees who lose their coverage will go directly to the government exchange, leaving the broker, you guys, out in the cold. So let me repeat that. Because this is the whole point and how you make a lot of money right now, without a private exchange solution, employees who lose their coverage will go to the government exchange, leaving the broker out in the cold. Second, making money through dental. In our blog post, Dental Insurance, a Big Opportunity During the ACA Downtime, we address the largest opportunity for brokers outside open enrollment. Creating qualifying events to sell health policies is getting increasingly easy as renewal rates are reaching employers. However, there is another way to sneak in some commissions before the next open enrollment, and you can do it while you prospect. Roughly 86% of enrollees from exchanges opted not to purchase a standalone dental plan. Now that's a lot of people not protecting their pearly whites. Also, while 127 million Americans have dental coverage through their employer, 180 million don't. Now, if an employer has a group health policy in place, but no dental plan, writing individual dental policies gets you indoors with an employer. So next open enrollment, use that relationship to sign up individuals for health insurance that opted out of the group health policy. Voluntary agents already know this and really are capitalizing on this. Now, most of you have seen the enrollment numbers being reported by the news. Now that the dust has cleared, some carriers are chiming in with their own reports, like Blue Cross Blue Shield of Texas has posted these enrollment numbers. Texas Blues are showing that, contrary to popular reports, off-exchange policies are not competing with on-exchange policies in enrollments. On the other hand, the number of off-exchange policies are substantial, reinforcing the fact that brokers need the capability to offer both types of plans. So, what do these numbers tell us? First of all, the middle-of-the-road silver plans are dominating the metal categories, with bronze coming in a distant second. This tells us that customers are taking advantage of the premium tax credits and subsidies available to the silver level plans. However, with the dismal sales performance of gold plans, we can see that customers would rather buy down than buy up with their subsidies. Surprise, surprise, price matters. The Affordable Care Act was supposed to be a strong-armed approach to getting everyone insured by requiring coverage or else. However, employers are starting to wonder what or else means for their bottom line. So in order to maintain a group policy, employers have to consider administrative costs, the new COBRA reporting requirements, and ERISA compliance. With the look-back policy for group size becoming more and more complicated, and ERISA audits more commonplace, the business of group health benefits is just way too much paperwork and headache. So don't let your employers drown in a sea of paperwork. This guy doesn't look very happy. I wouldn't want my clients to drown in paperwork like this. So despite the moral obligation that employers face to provide benefits to their employees, most employers will be hard-pressed to find a reason not to drop group coverage, whether it be higher premium costs, administrative headache, or employee outcry over rising costs. Employers will be looking for an answer to their dilemma. So be the broker in your market that keeps those employers in good shape. Don't let their bloated group policy hurt their bottom line. I'm going to let Doug take over again so that he can show you how to tackle these employers before the next open enrollment. Go for it, Doug.
Thank you, Kyle. That's difficult to follow, but I'm actually going to ask you a simple question. What is the easiest way to engage with this ever-changing marketplace? I believe it's by using the Private Exchange Broker Blueprint. The Private Exchange Broker Blueprint, or PEB for short, is an HPA-powered private healthcare exchange supported by our tools, training, and technology. And part of PEB is the Insight Catalyst Report, one of the strongest marketing tools available to HPA-powered brokers, as we saw with Rick Kesecker's example earlier. The Insight Catalyst Report, or ICR, is a door opener like you've never seen, and it's exactly what employers are wanting and needing right now. Both PEB and the ICR are guaranteeing brokers with the ability to participate in this massive market shift. And let me show you how. The private exchange broker blueprint is made up of several parts. It's not just a private exchange site. And that's what sets us apart from anyone else out there providing a run-of-the-mill exchange site. So I'm going to break down the parts for you real quick. What you're seeing here is an example of an HPA-powered private healthcare exchange. This is your fully customizable online marketplace. It's a warehouse of insurance products. Basically, this is the catalog you would show to a customer. This is where we want to direct your clients to view the products you have chosen or the ones you are sending to the call center to sell for you. And this is just one of several templates and looks to our exchange site options. Our partners customize these with their own logos or with the branding of the employers with whom they're working. Another part of PEB is Agent Cubed. This is the client relationship manager attached to your exchange, and it allows you to track leads, whether they go to the call center for handling or to yourself. So basically, you can be out advising clients, consulting employers using the ICR, and even writing policies. Check Agent Cubed at the end of the day and see that a bunch of policies were sold by the call center. It's like putting your business on autopilot. And speaking of the call center, they will help individuals coming to your exchange get enrolled. Individuals will be enrolled telephonically on our exchanges. And this has been incredibly valuable to group agencies who don't have the staff to handle the level of volume created by dropping group. Not only can they handle health, but a number of other products as well, including accident, critical illness, life, property casualty, dental vision, and more. You basically have a staff and a warehouse of products that they will sell and you can profit from. For example, are you a voluntary or P&C agent? Well, now you can profit from health through your own private exchange. Next, we have the members area, which contains all the content we produce. All of the HPA white papers, coaching calls, and their PowerPoint decks, marketing materials, and a variety of different content is located here. There's actually so much content, I would say about 3 years worth, that new members will get a personal tour from their account manager. New members get especially excited when they see all the professionally created, ready-to-use marketing tools that we provide so that they can immediately start marketing their private exchange site. All of the marketing tools can be customized for you or your agency. It really is a remarkable amount of collateral all ready for you to use. For example, our newest white paper, How to Generate Leads and Make More Money, is available right now to our members. HPA and our partners have already been through one open enrollment using our tools, training, and technology. We saw lots of success and we want to replicate it. In this white paper, we have compiled the best practices from our top producers, and we are now sharing them with you. HPA partners who are using these techniques are seeing a few thousand a month in commissions outside of open enrollment. And this white paper is available to our members right now. We'll be launching it to the public in the next couple of days. And I just want to give a quick shout out to these three fine folks. Valerie, Richard, and Michael were our top earners for April. They earn the most money through their private exchange sites and business done by the fulfillment center on their behalf in the month of April. Awesome job, folks. Now we're going to spend a bit more time with the Insight Calcs report because, as I've already mentioned, it's quite awesome and I'm proud of it. There really is nothing like it on the market. Not only is it an incredibly strong marketing and consulting piece, but it includes a quoting engine and enrollment process. It provides employers with the information they're desperately needing and wanting, and it allows you to create qualifying events. And now remember, that's the only way to sell individual policies after or outside of open enrollment. And this triggers a special enrollment period that will allow Americans to sign up for individual coverage. Once the employer has the report, it will create a pool of prospects that can purchase individual health insurance through your private exchange site, whether it's off or on exchange. And you are creating a constant stream of new customers. With this powerful tool, you control the way the group acts. You make sure the individuals, as they come off their group plan, if they come off their group plan, come to you for their coverage. You just became that business industry expert, and you can think of all the referrals you will get. So here's a look at the entire process when using the ICR. First, to collect the employer's company information, we have a handy wizard, which is a quick 5-step process. We provide what you need to get a census completed, and once you drop it into the ICR generator from within your members area, the report will be done and you can check it out and share it with the employer. Every report has an executive summary page, which is the main information the business owner wants to see. It's the bottom line and tells them, in a nutshell, whether it makes sense or not to drop their group coverage, and tells them how much premium reduction their employees could be eligible for and how much money they can save by dropping their group coverage. Once you have the report, you can schedule a call with your HPA account manager, and they'll consult on how best to present and proceed with the report. We'll also review and answer any detailed questions the report might provide. And then the employer is given access to tools that enable them to see the report, and if they choose to, they can also review and send individual reports to each employee. The employee's view is unique to them and shows them how much subsidies they'd be eligible for, along with possible plan options and instructions on how they can purchase or find out more about any of the plans shown to them. And get this, by selling the report to employers, you can generate immediate revenue, and it's free for you. But the report retails between $500 and $1,500, and employees will pay it because they want and need this information. So, even if the report ends up showing that it makes sense for the employer to stay on their group plan for the time being, you'll still have provided them peace of mind, strengthened your relationship with them by providing them with answers they needed, and you've made money by selling the report itself. This is a fantastic consulting tool. So, you can see that the private exchange broker blueprint is really a unique and robust set of services, collateral, and material. But I really haven't done it justice on this call. In a moment, I'm going to give you a website where you can go learn more about it, and I encourage you to do just that. So here are the pricing options, and I will briefly mention everything you receive. As a partner, this is what you're going to get by joining HPA. Whether you are on a contract or paying month to month, you will receive a customizable private exchange site, 20% revenue share if you're using the call center, training on how to market your exchange site, customizable marketing materials and presentations, a customer relationship management system, a dedicated account manager to help you get started quickly, and free ICRs for the life of your membership. And they do retail between $500 and $1,500 per report directed to you. So just a note here, you'll notice that if you sell one ICR a month, you've basically paid for your partnership with HPA. And our partners are getting a lot more than one a month right now. Anyway, moving on. Partner Plus would be great for agents and agencies who are interested in building a team. We bumped you up to 25% revenue share with the call center, and you can see a revenue share from your downline. You also get additional support from the business development staff who will help you build your team. And you can order online or on the phone right now. And now is the best time to get started. We will help you focus on small group employers now in the second quarter, and they begin shifting back into the individual marketplace and prepare for open enrollment. So here's what you need. If you're wanting additional information, we have some really great videos that do go into more detail about HPA services. Just go to www.privateexchangebrokerblueprint.com to access those. But if you really get it and you're ready to get started now, go directly to our order page at privateexchangebrokerblueprint.com/order form. or give us a call, and we can help you assist in getting signed up. We have business development managers standing by to answer any questions. And we're going to be pushing these links to you directly through the questions and comments sections in your control panel. So if you go to the question section in your control panel and go to webinar, you should see them come through in just a second in the very bottom of that panel. You may need to expand it if you're collapsed in these sections, or just take a screenshot of this page here.
I'd like to thank everyone for joining us on the call today. Now, I'd personally like to thank all of our current partners on the call, including Mr. Rick Kesecker, for joining us today. My team and I look forward to hearing from you and answering any questions. Happy selling, everyone.